Right. Good.
Good.
Cool. So we're going to actually be recording this. Just wanted to let everybody know that we're going to be doing the recording. We're also going to be posting this on our YouTube page. So if you guys are interested in getting this recording, please send us an email to the org box and we'll make sure that we get that out to you guys. So we'll start off. I'm Sergeant Arnold. Been in the Air Force for 18 years. And yeah, right now we're located in Burlington, Massachusetts. And we are your physical therapist Air Force recruiters.
That's correct. And I'm Master Sergeant Branham. I've been in the Air Force going on 20 years. As mentioned, we are located in Burlington, Massachusetts. Yeah. So we also have a couple guests with us today. We have Captain Giles, who is a physical therapist in the Air Force active duty, and Major Bus. Yeah. So we appreciate you guys logging in and helping us out with this briefing. So. All right. Who is not muted? Somebody. There we go. All right. So for today's agenda, we're going to be going over some eligibility requirements. We're going to talk about the DPT position and give you a brief description about that. Talk about some of the advantages to being a DPT in the Air Force, training and professional growth, as well as regular Air Force benefits. The next steps if you decide this is something that you want to do, and then we're going to answer any questions that you may have.
Cool. So eligibility requirements for DPT in the Air Force is you have to pass the military physical. You also have to have an entry-level doctorate of physical therapy, and then also be a U.S. citizen, be commissioned as an officer by the age of 42. And lastly, have a current unrestricted physical therapy license prior to entering active duty.
All right, so per our program announcement, here is the position description for a DPT in the Air Force. Air Force physical therapists are actively involved in injury prevention, injury management, rehabilitation, and human performance optimization throughout a variety of clinical and operational environments. They manage physical therapy clinics and programs in diverse settings with a focus on orthopedic and sports physical therapy practice. Clinical duties include evaluation, diagnosis, treatment, and management of musculoskeletal conditions that may impair movement or function. Physical therapist services are provided by direct access and referral. Air Force physical therapists have the ability to order diagnostic imaging, laboratory studies, selected medications, and consults, or refer to other specialists. They plan and administer treatment programs designed to quickly restore the patient's function, relieve pain, and prevent disease and injury. Air Force PTs may develop and implement medical teaching and research programs. They may provide ergonomic services, wellness activities, screening and promotion of healthy lifestyles, acute wound management, concussion management, and serve as musculoskeletal consultants for other healthcare professionals. Air Force physical therapists are stationed throughout the world, deploy for expeditionary operations, and support humanitarian missions. They may work in traditional clinical settings or embedded in special warfare units, flying squadrons, or other operational units.
All right, awesome. So Captain Giles or Major Buzz, do you guys have anything to add to the position title for DPT, or we basically hit everything?
I guess this is Captain Bus. I pin on Major in about a month, but thank you.
Oh, okay.
Yeah. I just wanted to, I guess it's in here, but I just wanted to reiterate that the physical therapy role in the military is a little bit more extensive. The deployment that's listed in the position description, and also that health and wellness and those ergonomic services. That is something that you might not typically see in the civilian world in all cases, but it is something that we do a lot of in active duty. So I think it's well captured here, but just note that it's more than just the words on the paper. We actually do all those extra things as well.
Awesome, thank you. Cool. So some of the advantages to being a DPT in the Air Force. So you'll also be able to practice physical therapy at a level beyond your civilian counterparts, with privileges to order diagnostic imaging, prescribe basic pharmaceuticals, and refer patients directly to specialty clinics. You'll also be able to provide care for highly diverse population of airmen and their families, and will have access to a vast consultation network of physicians, operational therapists, and other healthcare professionals. Along with planning, developing, and managing physical therapy programs and activities, you may be called upon to develop and implement teaching and research programs. You may also serve as a liaison between the Air Force, civilian, and governmental agencies involved with physical therapy programs.
Some more advantages to being a DPT in the Air Force. So the Air Force has distinct advantages over civilian practice. You'll see patients based on their needs and not their ability to pay. Along with no malpractice insurance to worry about, you won't have to deal with overhead expenses or red tape associated with regular HMOs. You may also have opportunities to participate in humanitarian missions around the world, as mentioned. These opportunities not only enhance your career, they enrich your life with experiences that are unmatched in civilian practice.
So as far as DPTs on the line, do you guys have anything to add to those advantages?
Yes, Captain Giles. I would love to just kind of reiterate the fact that we're not run by insurance. So when I was a civilian PT, I had to obviously obey sort of the insurance rules and kind of take what the patient might have in their bank. So let's say they only had 8 visits. I had to kind of make my treatment plan around that 8 visits, or hopefully not use all that 8 visits. And now, sky's the limit. So I don't discharge patients anymore. I kind of encourage them, like, hey, we got over this ailment right now, but continue to use us. Let's do gait analysis. Let's look at your squat form. Let's do some preventative stuff. Like, you don't always have to come to us when you hurt. We're here for you in health and in sickness.
That's awesome. That's awesome. Thanks for that input.
This is Captain Buss. I'll follow on and just say another big advantage going along with that insurance piece is the true ability to have direct access. Again, in civilian model, I could do direct access with some of my patients based on their insurance, but some of them I couldn't. In the military model, anyone can walk in and see us directly, and I don't have to figure out, can I do that? Do I have to have a referral from a doctor? I can treat them on the spot when they're ready to be treated and get that care to them a little bit quicker. So a lot of that stuff isn't really a worry. The constant phone calls that I did on the civilian side, I don't see that in the military side, which is a benefit, and it allows me to focus on the patient even more.
Awesome. That's great. Yeah.
Yeah. I mean, and even from the patient perspective, I know whenever I messed my back up, it was very, very nice for my doctor to be able to actually hand walk me back to the DPTs and have them show me how to properly stretch and do what I had to do to relieve that pain. So anyway, moving on.
All right. So training as an Air Force DPT. As an Air Force physical therapist, you'll be a member of the Biomedical Sciences Corps and also be a highly respected member of one of the world's premier healthcare teams. You'll enter active duty with the rank of captain and attend a 5-week commissioned officer training program at Maxwell Air Force Base in Alabama.
Can I interject on that real quick?
Yes, you can.
So it is no longer 5 weeks. It is the full 9-week OTS program. So you're going to go through the full 9 weeks with the rest of the trainees. So it used to be a 5-week sort of abbreviated COTS program that they used to call it, but they're starting to bring all the specialty, even doctors, lawyers, chaplains, through the full 9-week course now.
Okay, well, that's good to know.
Yes, it is.
Yeah.
Thanks for the heads up.
Yeah, thank you.
All right, so professional growth in the Air Force as a DPT. So the Air Force will give you the tools and training needed to succeed in your career. You'll achieve professional growth and development through leadership experiences, OJT, and continuing education. To help keep you current in your field or become an advanced specialist, we'll pay for your specialty board certification along with professional seminars or conferences. You'll never have to worry about losing income or arranging for someone to care for your patients while you're away. Do you guys want to elaborate on that at all?
So not only will they pay for your board certification, if you become something like a orthopedic clinical specialist or a sports clinical specialist, you'll also get an extra $500 a month. So that's a kind of a kick and pay at $6,000 a year just to get your board certification. So that's another nice perk. And I have yet to pay for any continuing education out of pocket.
Yep. And just as a follow-on, in civilian practice, the board certification rates run about 10%. So about 10% of physical therapists will have a board certification. I don't know the exact number in the military, but anecdotally, just kind of looking at my peer group, it's probably more along the lines of 50%. So that board certification is highly valued. And again, like Captain Giles said, they'll pay for it and then they'll pay you once you have it. There's also a distance military residency program that you can do when you come in the military. So again, it's all distance. You do it with a board certified instructor if you have one in your clinic, and then you go to kind of a capstone course. So that's also an option. And again, it's paid for and you're also earning full pay while you do it. So that's kind of nice as well.
Right, so just some of the benefits to becoming a DPT in the Air Force or being in the Air Force in general. We have an excellent starting salary with regular pay raises and promotions, 30 days of vacation that's paid each year, continuing education opportunities, tax-free housing and food allowances, comprehensive medical and dental, opportunities to live, work, and travel worldwide. And then we also have that generous retirement program.
All right, so if this is something that you decide you want to do, here's the next steps. First of all, we're going to have to complete your initial appointment, in which case just send us an email to that organizational box. We'll send you a pre-screen, and if everything looks good, we'll set that appointment up with you. After that appointment, we will request your source documentation, such as your driver's license, social security card, birth certificate, passport, any license and certifications that you may have. And at that point, we'll start building your profile in our system. Once that profile is basically complete, we will transfer you over to our pre-processing cell, and they will help get you set up with the military entrance processing station to get you in to take your physical. Once that physical is complete, if everything looks good, then they will work on your application with you to make sure that that is squared away and schedule you for any type of interviews that you may have to do, things to that nature. Once the application is complete, they will go ahead and submit that to the board. And at that point, we'll be just waiting to see if you're selected or not. If you are selected, you'll get pushed over to the post-processing cell. They will help you with your commissioning documentation, your background check, and things to that nature. So that is the process in a nutshell. What kind of questions do you guys have?
I have a couple questions. So first, I was wondering, as far as deployment goes, going, I guess, out of the United States. First off, how likely is that, or how much time might that be, and in which situations would I be able to bring my wife with me?
I can jump in on this one. First, I have not deployed as a physical therapist yet, so I'm just going to pass on what's been told to us kind of from our leaders in physical therapy. Over the course of a 20-year career, you should expect to deploy somewhere around 3 times. And each of those are generally a 6-month assignment. They are not places that are family friendly. So when we talk about those deployments, it's you going over, generally desert type areas. Africa is kind of a newer focus, but those locations, and again, 6 months. There are remote assignments where you might go to, say, Turkey or Korea for a year. Sometimes you can bring families and sometimes you can't. Turkey is one where you used to be able to bring families and now you can't. So just kind of consider those remote assignments maybe out there as well. And It wouldn't be guaranteed for you to bring a family. Usually for us, if you do a year-long remote assignment, usually that kind of counts as a deployment. So in other words, looking at that 3 over the course of a 20-year career, if you did that 1 year away, usually it kind of counts for a deployment number in there.
I have one more question. So that process that you laid out on the last slide, when does that start? Like how far before graduation? I'm a student right now.
Are you in your 4th year?
I'm in the, I have 1 more year of PT school.
Okay.
So I would start at about halfway through your final year.
Okay. All right.
So this is Captain Giles again. My first application, I started basically my last semester of my 3rd year. So when I was doing all my clinical rotations, I started my first Air Force package. That year, they were only taking 2 direct accession PT, so basically bringing a civilian in as active duty physical therapist. So I didn't get it that year. I applied the subsequent year with Sergeant Spinazzola and was selected as an alternate. So it meant I wasn't fully selected, but I'd met all the requirements needed by the Air Force, and so I was just in a holding pattern until maybe some slots opened up or those therapists that were selected maybe fell through, and then I was kind of next in line to take that. And that year they took 16. Once the 2020 list got released, they were taking, I think, like 27. And since I was already an alternate, I was immediately slotted for the 2020 fiscal year. So I just bring that up that just because you don't get it the first time, keep pressing. I saved all my information from the first application process and just resubmitted it each continuous year, and 3rd time was a charm.
Yep. And just
Sergeant Spinazzola. So Captain Giles, when he applied within his last year of school, so anyone that's on the line, if you're within a year of graduating, you can do as Captain Giles did. And like he said before, he didn't get picked up that first time, but as the next board came around, he gained experience. We got new letters of recommendations, and he did get selected as an alternate. And as the physical therapist requirement for the Air Force goes up, those alternates towards the end of the year will ultimately either be selected like Captain Giles was, or possibly rolled over to the next fiscal year, since they're already what the Air Force is looking for.
And just as another add-in, when I talk to applicants, I always want them to know it's very competitive right now. And so you should know that going into the program. Our civilian practice is a little soft due to COVID, due to some other factors. So, when we compare the military lifestyle, pay, and benefits, we're kind of winning right now. So that means there's generally a lot of applicants for these slots. So that said, when they look at applicants across the board, there tends to be favor towards experienced physical therapists. So we don't see a lot of brand new, right out of school people come in. So when I talk to applicants, I always say, have a backup plan to go work in the civilian sector for a year or 2 years and continue to apply. It's pretty common that most of us applied up to 2 or 3 times before we got in. And then in that time, we were practicing civilian therapist. So we gained a lot of experience, and then that helped our resume. So just sort of to manage expectations, have that in your head. Don't let it stop you from applying now, but just expect to maybe have that backup plan while you wait through this application process.
That's a good point, ma'am. Definitely maybe having that 1 year. I mean, not to stop you from applying now, because you can apply again, but always having that 1 to 2 year experience will help with you being competitive with the board. Also, even reaching out to your recruiters. I've done this a couple of times. If there's a base nearby, seeing if you can get some shadow training. Get with your recruiter and see if they can get you on base and work with the DPT there. I know I've never been told no when I've done it, and it really worked, and it really helps help you make that decision as well, because that commitment is huge once you get started in the process and possibly selected.
So on that, is there anything in particular the Air Force is looking for, like grades from school, scores from the licensing exam, or certain kinds of work experience or certifications, something like that?
I can start on this one. There definitely are preference factors, and it doesn't mean that you have to have all of these, but these are just things that tend to come up. Having a board certification is obviously a huge one. It makes you more competitive. We preference towards orthopedic and also the sports board certification. If you come in with experience in manual therapy, dry needling, those are also two others that I think are sort of preference factors. Again, as a new grad, you won't have those, and that's okay. I was a new grad, I applied. I still had to take a couple of rounds and apply 2 times before I got picked up. I didn't have those things, but I think it's worth mentioning that those are preference factors. There might be really experienced physical therapists listening in here, and those would stand out. And again, orthopedic background. When you come out of school and you work primarily, say, in a nursing home setting, those skills may not transfer quite as well. Primarily what we do is orthopedic. And so we'll value those skills probably a little higher than if you have only experience in a different type of setting.
Letters of recommendation are going to be really helpful, and I know this doesn't apply to everyone, but if you getting those shadow hours and establishing a good relationship with maybe an active duty physical therapist who can kind of speak to you as a person and just your desire and your motivation and discipline and all those things that the Air Force is looking for can be really helpful. So think about your letters of recommendation. They usually want at least a supervisor. So in your current clinic, they wanted a professor of mine from my education program to write a recommendation. And then I also had an active duty Air Force officer be able to write a letter of recommendation on my behalf. So those letters of recs can be pretty helpful and impactful sometimes, especially if you can have someone who's already kind of doing this say, no, this is definitely someone we want.
And then one more additional factor is leadership ability. I know the recruiters will ask you about it, and I was asked to highlight that on my resume. But the reason we look for that is for some of you, if you come into the military, you're going to be a clinic manager and a flight commander from day one. And so I think showing that you have some leadership ability and you're comfortable in that role is something they'll look for. And it doesn't have to be with your DPT program. I mean, it can be community involvement, but just showing that you are comfortable leading a team, because that might be your day one.
Captain Bus, you bring up an awesome point with that. So prime example, Captain Bus included, I've been in the Air Force for 1.5 years and I'm already a flight commander, squadron exec, and running 3 different programs, 2 in the med group and 1 is a base-wide program. So and running the clinic on top of that. So it's more than just being a clinician. As an officer, you'll eventually start to step into some leadership roles and start to drive programs and develop things and start doing a lot more than patient care. So it's good to feel strong in those leadership roles and be okay with a lot on your plate at once and be efficient at managing all those different taskers you're going to end up getting.
What else do you guys have? Any other questions? Nothing?
All right. So I have some questions that we actually get quite often from the field when we take calls from DPTs that are trying to join. So what exactly does your typical day look like as DPT in the Air Force?
Kind of say a joke. I don't know if there is a typical day, but it's going to depend. And my PT students and probably are laughing right now because we hear that answer a lot. Part of it's going to depend on where you end up. If you end up at a big base like Lackland in San Antonio or Wright Pat in Ohio, those are big clinics with multiple active duty physical therapists, civilian physical therapists, physical therapy technicians. And so in that moment, as a new physical therapist, you're pretty much going to do patient care and patient care only. And the expectation is to right now see on average 9 patients a day. Now that's 9 encounters, so we usually book 12, knowing that, hey, some are going to no-show and some are going to cancel. If you end up somewhere like Minot, where I am, or FE Warren, where Captain Bus is, we're a one-man PT shop, so we only have one physical therapist. So from the get-go, we're kind of expected to do a little more than patient care. So a day-to-day for me initially was just standard patient care, and then it slowly became, now I need you to run the clinic. So that's balancing the budget, maintaining the equipment, making sure we have all the supplies we need, and ensuring that my technicians are getting the appropriate training they need to do their job. And now, 1.5 years later, I'm embedded in a squadron across base in the mornings, back in clinic in the afternoon, plus having to attend different meetings, and then, you know, being a committee chair on a couple different programs, sitting in on those meetings and helping improve different processes and things within the med group and the base. So right now, it's very dynamic. Every day is a little bit different. And again, just depends.
My day right now, we're a little bit more structured. We haven't had a physical therapist at this base for a while, so I'm just standing the clinic back up again. So I'm going to take traditional patients in the morning. I'm going to, you know, do my typical evals and treatments. And then in the afternoon, every afternoon, we're planning to have direct access walk-in care. So that means anyone who's active duty that has an injury can walk into us and be evaluated and treated. And then we'll reserve one afternoon a week to do what we call outreach, where we'll go out to a unit and we'll check out what they're doing. Might be the helicopter squadron or our security forces or our maintainers, and kind of see what they're doing and see if we can do some hands-on or stuff with them. So again, different from civilian care. Biggest thing for me is that direct access piece. I don't know who's going to come through the door. Some days I might see 2 patients, and some afternoons I have, you know, 8 patients. It just depends on who walks in.
Cool. Yeah. So that kind of leads me to my next question. What is your patient population? Like, what kind of population do you serve?
I'll kick this one off. So my clinic's active duty only. Some clinics you will see dependents and retirees, but my clinic, we only see the active duty population. I would say most of the time the career fields we get in here are the ones who have a higher physical demand. So think security forces, our military cops, our maintainers, those out on the flight line working on the aircraft. Although some populations, like our pilots, probably need us, they don't utilize us, and that's usually due to the fact that they love what they do and they want to keep flying, and they fear that we're going to put them on a profile and take what they love to do away from them. So those are career fields where things like Captain Bus is doing and we're doing here at Minot, as far as just getting out to the squadrons, talking to people, let them get to know you, to develop those relationships and figure out where the problems are, so we can maybe start a preventative approach and reach some of those folks that aren't utilizing the services we have here in the clinic.
Yep, and I agree with Captain Giles. I see only active duty patients. So therefore, my typical patient is between 18 and 25 generally, and generally male. I mean, those are just statistics of the military. And then, you know, with that population, generally we do have a lot of acute injuries, a little bit more than I saw in the civilian field. And then of course, your chronic conditions are there as well.
So, and then the last question that I typically get from physical therapists who are interested is, like, how would a person apply for CMEs? And does the Air Force cover all expenses? And how, like, often can they do a CME?
Ooh, that one's, I'll try to kick that one off. That one's a little dependent on your own ambition. The Air Force does have money to cover CMEs. Typically how the process works is we'll identify a course. For instance, I'm going to try to get my dry needling certification this summer. So I've identified a civilian course I want to go to, and then I have to submit paperwork for it. And it's called routing, meaning I submit the paperwork. It has to go to, you know, 5 different people to review it. And then if that's approved, if the budget is available for that year, they'll approve it. And then usually they'll actually reach out and pay for the course. So I don't do any of the money transaction myself. So I guess we're a little different because some civilian places will say you have X number of dollars for courses and that's it. In military practice, it's a little bit more on what do we need our practitioners to do. And so, for example, I need to dry needle. It's an expectation for us to deploy. They really like us to have that skill. So again, I just write up a justification saying, hey, I need this skill, and then I hope the budget aligns. And so far, I've had great luck. I've had everything that I've requested paid for. It's never guaranteed, of course, but I haven't had any issues myself.
So I'll piggyback off that a little bit. Ambition's huge, and then needs of the mission, right? So needs of the Air Force. What do we need our physical therapists to do? Being dry needling certified is kind of a career requirement. So they will. I've yet to hear of anyone not have that covered. Last year I went and I got SFMA, so the Selective Functional Movement Assessment certification. I paid for that out of pocket. The med group here, so our medical, our facility, I was still able to evaluate and treat and be effective with patients. The SFMA was just something I was interested in personally. The med group didn't see it as a valuable increase in capabilities because it just allowed me a new way of thinking about evaluating patients and treating them, but it didn't give me that skill set. I already had that skill set. So that one was out of pocket for me. So again, our favorite answer, it just depends. And some med groups have a little more money than others, and that comes into play too. What does the budget look like? Can they afford it? Some places don't have an issue getting continuing ed paid for. Others, it can be a little harder. But I will say the Air Force, due to our career requirements, you are going to get a ton of just military physical therapy education that is paid for. We'll do, usually every year at some point, we'll do something called a TDY where we go to a location to learn more about career field related things. OZO is a popular one that every 3 years we have to go to that. And that's just 12 days of pure physical therapy, manual, chronic pain science. They used to teach dry needling there. They don't anymore. Pharmacology, how to order imaging, when to order imaging. So it's 12 days straight of just raw physical therapy in the Air Force, and it's worth something like 66 credit hours. Past that, our symposium, where we go and we learn more of the clinical management side. Again, that counts towards CEs. The Air Force is paying you to go to those. So there are plenty of opportunities that the Air Force will pay for that it's strictly because it's required for us. And then sometimes, you know, some of those other things like the SFMA for me may or may not be covered. It just depends on your med group and how well you can sell it.
Awesome. Well, thanks for the answers. Does anybody else in the chat have a question? There's something in the chat there. Okay, cool. So yeah, as you guys can see below, eFlight has posted on here the YouTube link. So if you guys want to check out this video and see, you know, replay it to kind of see what happened today, you're more than welcome to do that. And then we'll also put in our email org box. That way you guys can email us and let us know, you know, that you're interested in the program itself, and we can get your packages started. Any other questions from the field before we let you guys go?
This is Captain Giles again. I'll go ahead and throw it out there. If y'all have a pen and paper, and I'll put it in, actually, I'll just put it in the chat. I'm going to give you my clinic number here at Minot Air Force Base. If there is anyone that might just have questions they want filtered offline, I'm more than happy to entertain those. I'm not always able to answer the phone. If I don't answer it, one of my technicians will. We can take a message, and I will do my best to get back to you, and we can kind of have an offline conversation about Air Force physical therapy or any other thing you may be interested in.
Awesome. Thank you, sir. Cool. So if nobody has anything else, I think we're going to head off here. Thank you, ma'am. So thank you to Captain Giles and Captain Buzz for joining us today. We really appreciate your input and your expertise in physical therapy in the Air Force. Yeah, I think it was a great session. We really appreciate you guys coming on the line.
For sure. Thank you.
Thank you. Thanks for hosting us.
Yeah, this was fun. Thank you.
All right.
All right. Hopefully we'll hear back from you guys.